Yes. Hi, Priya. Thanks so much for joining in here today. And I really look forward to learning so much about, psychosis and how you work in Aspire Clinic in Stanford University and also in other clinics that you work there with trauma. And I'm so excited that you could join me today here.
Yeah, happy to be here.
Yeah. So maybe we can start with getting to know you, like your journey, uh, how did you choose to become a psychologist? And yeah, could you take us to this journey? And
Sure. Yeah, I think I took a sort of a long and circuitous path to where I am today. I actually started off, my undergraduate degree was in chemistry, and then I got a degree in biotechnology. I came to the US for a PhD in cell biology. And I think a few years into the PhD program, I realized that I don't think I enjoyed doing basic sciences research. I felt like what I did had to be more tangible, that, it felt like, what I was learning was not going to actually impact anybody's life in the foreseeable future. And that felt, I mean, obviously, we need basic sciences research, but it just was not my jam. So I quit the PhD program and I was trying to figure out what I wanted to do. I, worked in the software business for a few years while I was trying to figure it out. I had friends who were in the mental health space. And so, it was something that was always interesting to me.
Mhm,
But I wasn't sure if, this was the right fit for me. And already having gone down one path, which didn't quite work out, I didn't want to do that again. At that point, I had the opportunity. I moved back to India for a few years and had this, actually, now looking back, a really amazing opportunity. I got to volunteer at um, an, a place run by the Richmond Fellowship Society in Bangalore.
mhm,
And it was a halfway house for people with schizophrenia and bipolar disorder. And that was really, in some ways, my first sort of uh, looking back, it was not my first encounter, but I think it was the first time that I knew that, what psychosis was, and I think it was a really lovely introduction because this place was a therapeutic community. So
mhm,
everybody was treated, equally. It was not, there was not much hierarchy. And, I remember, talking to somebody who was there who was about my age, who had very similar life trajectory as me. And,
mhm,
we had read the same books, we watched the same movies, and, you really connect as a human being. And, one day, she wasn't doing so well, and, she was saying things that didn't make much sense to me. But then, a few days later, we were back to, connecting as, two human beings who had a lot in common. And I think that was a really good experience. And I realized that I was lucky in that not everybody has that kind of an introduction to people with psychosis. And then looking back, of course, there were people that I knew, growing up around me who had experienced psychosis, but we had no words for it. We had no language to describe it. It was just like considered something like out of the ordinary.
mhm,
Anyway, so that sort of really made me feel like this was the right choice for me. And, I moved back to the US, got my PhD in clinical psychology, and, here I am many years later. So
mhm,
that sort of, like I said, it was a long and winding path, but I think,
mhm.
some people never figure out what they want to
Yeah. Mhm.
do and exactly what I wanted to do. So I
Yeah, yeah, that's true. Like
think
there's
there's a little bit of a lag.
yeah,
Can you hear me?
yeah, I can hear you. Right. So yeah, that's true. That it's not a sequential path, right? It's not that you do step by step and you go there. It's always like it's like there's a moment in your life where you're actually having this soul searching time when you quit your PhD and you're trying to explore what you really want to do. This period seems like more like wandering and asking maybe deeper questions from yourself or just Yeah, would you want to take us this period? What was it like for you?
I could lie and say I was I think I could lie and say it was a period of soul searching and deeper questions.
Okay.
I think that would be romanticizing that time. I think I was trying to figure out, like, I was sort of open to all possibilities, and I was sort of just keeping my eyes and ears open to see what really spoke to me. I considered a variety of things, and then, like I said, I'm one of those lucky people who ended up finding the right fit, I think, for them.
Mhm, mhm. Yeah, it also feels like, I mean, of course, if not romanticizing, it also feels like as if the existential suffering was speaking to you, like something was that brought you to a space of working with people with psychosis and schizophrenia. There's some connection with, some connection.
Yeah, I think it wasn't so much at that point. I don't think I was thinking about the suffering so much.
Mm-hmm,
I think what really caught me was, these were people just like me, right? I mean, it could be, I could be having a conversation, and they are people just like me, right?
yeah.
But yet, at times, they were saying things and doing things that didn't make any sense to me. So I was really fascinated by what that switch was. And at that point, I think I, might have thought about it differently. It felt like, in those moments when somebody's in the middle of an episode of psychosis, at that point, it certainly felt like, their behaviors or their beliefs were not something that I could explain or understand. I think that has been the big growth for me, where I think it's not that hard to be able to put myself in the shoes of somebody. Full disclosure, I've never experienced psychosis, but it doesn't seem so far away from the thoughts that I've had or the experiences that I've had. Again, not to minimize the anguish or the distress that somebody with psychosis might experience, but really, I think of psychosis as really a more extreme version of things that many of us as human beings experience. So I think it was much more the shared humanity
Mm-hmm,
than the existential angst or the distress at that point. I think that really appealed to me.
all right, so that's beautiful. Like you could feel the kinship, like some sense of we're all on a same plane, right? It's just that
Exactly. Right.
the intensity of the experience is a bit more extreme than usual. We would also experience, everyone will experience the same way. Yeah,
Yes, and that's what I believe now. I think at that point I still was trying to figure out what all of this was. It was just fascinating to me. And
Mhm.
then yes, absolutely. Yeah.
Okay, that's great. So I also wanted to understand that once you were more surer that okay, this is something, the path that you want to walk with, you want to understand the experience of other person who's going through psychosis, but there's just a phase, just a part of their personality which feels like with you don't make sense of. It's chaos. It feels like a disorder, but then they come back to this sense of normalcy, which all of us feel. So when you went to study in clinical psychology program in US, how was that experience for you? How was the training like there? What did you
So
felt there?
yeah, so I think the training I did have up I can think of a couple of instances in my PhD program outside. I mean, we did a lot of practicum training, so we were placed in like hospital settings and clinics and so on. So I learned a lot there. But in terms of my classes per se, there was maybe one class where we were exposed to thinking about psychosis and treatments for psychosis and so on.
Hmm.
And so not a lot. And the general, I think the sort of the thought at that point was still, when I would tell people, oh, so I had sort of two parallel tracks. I was doing a lot of like neuropsychological assessments, and I was working with people with psychosis. So I kept those two tracks, all the way through, actually till my postdoc.
Hmm.
And then, I sort of switched to completely working with, I don't do neuropsych assessments so much anymore, actually, in the last few years.
Hmm.
But I think the the what was told to me, and I think what a lot of people around me believe for the most part, was that my job as a therapist would be to bring people into the clinic to make sure they met with the psychiatrist and that they would take their medication. That the medication was the primary treatment, and my job was really just sort of an enticement to come into the clinic to engage in the treatment. And my job was to sort of problem solve whatever was getting in the way of them engaging in the right treatment.
Mm-hmm.
What I believe now is completely, the opposite,
Mm-hmm.
in the sense that I think I'm not anti-medications. I'm not, I don't think everybody needs medications. I don't think nobody needs medications. Medications can be life-saving for some people, not so great for other people.
Yes.
And I think I think that people actually make the biggest strides that really make long-lasting change when they understand what's going on with them, understand their experiences through the lens of their own mind,
Mm-hmm.
and make sense. It's really about the meaning making and making sense of the experiences that really, I think, create long-lasting change. And medications can be really helpful in sort of taking that edge of the pain off. Like if somebody is very, very distressed and they can't even sit or focus on a conversation,
Mm-hmm.
clearly, therapy is not going to help. It's just so I think medications are helpful in taking that
Yeah.
edge off. But I don't think medications are the be all and end all, treatment. And I really think of psychosis really as a social construct in some ways, that's embedded in a society, in a culture,
Mm-hmm.
because the beliefs that come are in some ways are different across different societies. Somewhere in some societies, the beliefs might be that it might be related to spirituality. In other societies, it might be related to, whatever, maybe in the US, it might be whatever, the FBI or,
Aliens.
that's, whatever, right? Aliens and so on. And so again, it depends on the cultural background of the person. And that also, I think, impacts how the person, again, it's the meaning making, right? I mean, if you think about that spectrum between somebody who experiences psychosis and some of our very revered, maybe religious and spiritual leaders, it can be very hard sometimes to say, what is what, right? So it's about the way I define psychosis, the way we think about it is, first of all, it's a temporary state, which
Mm-hmm.
means that if somebody experiences a psychosis, it doesn't mean that they're going to be in that state for the rest of their lives.
Mm-hmm.
It's a temporary state of a difference in, between what they're feeling and their experiences and sort of consensus reality, right? What most people around them believe. So if I, for example, you talked about aliens, if I come from a family where everybody believes that, we're all aliens, or, we're seeing aliens walking around, or that we were abducted by aliens, if I believe that also, that would not be psychosis. That would just be a cultural belief,
Mm-hmm.
right? I mean, if you think about, religious beliefs, so you think about, sports teams that you might support, or, things like that, right? We might have very, very different opinions that we may not ever want to believe the other person's point of view or by the other person's point of view. Yet that's not psychosis. It's even if it's causing me distress, right?
Mm-hmm.
Even if I say, you are a whatever, you support that other sports team, and I, cannot talk to you because, I can't stand your team. It's
Yeah.
still, and it's causing me distress. It still is not psychosis because I belong to a group of other people that feel the same way. So it has to be different from the sort of consensus
Mm-hmm.
reality of my subgroup. Again, it becomes very difficult, right? Because it's easy to define all of these things in theory, but in real life, what does that really mean? And it also has to cause significant distress or difficulty in sort of everyday functioning, right? It has to get in the way of my being able to go to work, or, earn a living, or, whatever I want to do.
Yeah.
And so, again, there are lots of studies that are starting to talk about this, is that, when people have, for example, like, hearing voices,
Mm-hmm.
initially these voices may not be very scary till somebody around them says, oh my God, you're hearing voices. That must mean that there's something wrong with you.
Yeah.
And so then suddenly those voices also take on a more nasty turn, and
Yes.
the whole tone of everything changes. So it's really, so again, it's I think psychosis is something that we have to understand in context. It's
Yeah.
long-winded way of saying that.
No, no, I really appreciate your, trying to express as best as possible to convey that there's a cultural context which is very important, and also how we respond to somebody's experience which may seem unusual, like maybe, for example, certain kind of thoughts, unusual thoughts, or certain kind of voices. How we respond to them also affects so much, the relationship with these experiences. So certainly, if I totally agree with you, if somebody has a voice, hearing voice, and somebody says very harsh thing about it, the person feel may much more worse about the voice, and the voice can also get in some ways. I also was thinking, when you talk about cultural context, you did brought in, I think, the the story of Ramana Maharshi, right, that we talked about last time. I wonder if you want to share that. Is it something you also share in your classrooms there, or that I'm
We
under?
did
Or,
talk about it. Yeah, we did talk about it in our class.
mm,
The last time we taught the class. I mean, yeah, I mean, so if you look at the story of Ramana Maharishi, who is, like a well-known, spiritual leader for many people, very revered spiritual leader, who lived in the last century. Essentially, if you look at his life story, I think when he was maybe as a teenager, he had this experience. I don't remember the exact age, but at some point, he had this experience where he thought his body was on fire. He thought he was dead. He wasn't sure if he believed truly that he was dead. He ran away from home. I think his family tried to bring him back. He would run away again. He was, found like hiding, I think, like under a, in a basement of a temple or under a tree.
mm,
At some point, he was like covered with vermin and he was meditating. And, something that we talk about a lot is, if somebody like that was to be brought to our clinic, some young man is brought in by his family and they say, oh, he's not eating, he's sitting under a tree, he's covered with ants and, rats are like biting on his
yes.
toes, we would admit him, no questions asked. We would
Mhm.
absolutely admit him. Chances are we would, medicate him, we would like force treatment on him. That's just the way we think about it, right?
Yeah.
But then,
Yeah.
you wonder, like, for somebody like Ramana Maharishi, maybe that was the path to, him being able to, explore these thoughts in a way that, has
Mhm.
actually provided
Mhm.
calm and provided like support to millions of his followers.
Mhm.
And so, again, what is the, like, how do we define, what is spirituality? What is,
Mhm.
psychosis? I don't know. Again, it sounds very cool when you say, oh yeah, of course, we know sort of the life trajectory of Ramana Maharishi. So we're able to say, yeah, yes, it would not have made sense to hospitalize him. But if a
Mhm.
young man comes in, of course, we're going to say, we don't know what's going to happen. We're going to, push treatments on them, give them a diagnosis, and maybe they become a pariah because of that, right? We say, oh, this is now you have this disease, you have this, this stigma around it, people start treating you differently, and then
Mhm.
so I don't. So it's a very it's something that bothers me a lot
Yeah.
in terms of like how we treat people, and to your earlier point in terms of how we react when people initially have these experiences as a mental health provider. That is something I'm very acutely aware of also,
Mhm.
is that I don't want to be the person who says, "Oh my God, you're hearing voices. This is a bad thing," because that might have a very lasting impact on them. Because
Yes.
I truly believe, and I'm not just making it up, right? I truly believe that a lot of people hear voices. Some voices are distressing. Some voices are not so distressing. I mean, I think by some reports, about 15% of all adults have heard voices at some point in their lives.
Mhm.
Most of them don't, reach out for clinical services.
Mhm.
They manage just fine. It's a very small percentage that actually end up, needing to see somebody for treatment. And so, if we respond differently, if we respond from a place of curiosity rather than a place of fear,
Hmm.
maybe, the voices will, I mean, the way we think about it is voices are, in some, even though they feel very alien, they are really representations of, sort of beliefs that a person has, deep inside that maybe they're not even aware of, or fears that they might have.
Hmm.
And so if we're actually able to think about them in that way, then
Yeah.
maybe it can sort of neutralize the damage that
Yeah. Yeah. At least not
we can do.
overburden or create a secondary trauma on it,
Exactly.
which is already there, right? So
Right.
if
Right.
so let's approach the voice. Let's say the voice is just one kind of hallucination or people see or tactile. So if we approach hallucination or voices with curiosity and we try to sit with that, of course it takes away the fear of just judging and strong burden of the trauma of being responded with harshness. Then as we get to meet the person, right, and we're sitting curiously with this their voices, um and we're trying to make sense of it. And as you said, like there is a deeper inner fears that the person is not aware of where the voices are coming from. Can we go deeper into it and see what is these voices are in your experiences? Why are they where they coming from? Are they coming from some traumas or abuses, neglect, or
It
somebody?
could,
Yeah.
yeah, very, very well, possible that they come from some kind of trauma. And when I say trauma, it may not mean like criterion A trauma for PTSD, but some difficult life experience. It could be, some interpersonal struggle. It could be neglect, abuse. Anything physical. Anything. Um, and I think these are often the the way I think about it. Again, I have to acknowledge my position, right? Like I am not a voice hearer myself.
Mhm.
I'm just very privileged to have worked with a number of people who are voice hearers. And I'm sort of learning, I'm not an expert on anything, right? I
Mhm.
sort of throw out tidbits, provide some tools, and they are the people who teach me,
Mhm.
they're the ones who are trying out these tools, trying out things. Then they come back and say, well, this worked or this didn't work. And I'm learning from them really. So I want to make sure I acknowledge that. Like I'm no expert. I, don't know. I can't tell you what is going on
So,
with,
so
with somebody,
yeah.
right? So, but I think often these voices, if you sort of look beneath the surface, not the actual, maybe the words that they're using, but often the emotion that they convey or the deeper message that they're sending are often can be related to past difficult life experiences.
Mhm.
Because often these voices will say, uh, will say things that
Nasty.
suggest that the person is not safe, for example, right? They might
Like
say,
that.
I'm going to kill you, I'm going to whatever.
Yeah.
Again, that sort of that brings an emotion of fear, and that might be rooted in a situation where maybe they were not safe at some point, right? They might have been through situations, and often you can tie it back to these situations where, again, it may not be the exact content of the voices, but it's the tone of the voice, the emotional tone of the voice, right?
Mhm.
That emotion often is conveying something to us. The other thing is also that, another very common uh, sort of theme that we see is that, you're no good, you're useless, you're pathetic, you're a loser, things like that. Again, those again might be, very deeply held beliefs that the person has about themselves, sort of core beliefs. I'm a CBT trained therapist, so I'm going to use CBT language, right? So they might have these core beliefs of,
Schema, right? It's called
yeah,
schema.
exactly, right? Yeah. Yeah, exactly. Of, that I am no use, I'm useless, I, can't do anything, right? These things. And I think the reason why some of these sort of are seen as voices could be that, these are thoughts or beliefs that are so icky in some ways. They're so uncomfortable. Like I really don't want to think of myself as a loser, right? I mean, I want to, so I'm trying to say, no, 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 I'm actually okay. But if deep
Mhm.
down I believe that, and that's sort of bubbling up to the surface, it's easier to think of it as it's coming from somewhere else rather than this is something that I am saying about myself. Because why would I say such nasty things about myself?
Mhm.
And so sometimes it's about approaching those themes and those emotions without, I mean, like that, just because I think that I'm incapable of doing things, I think I'm useless, does not mean that I am. Clearly, I don't think any human being is useless. I don't think any human being is worthless. There is no such thing, right? But these are beliefs that people often have.
Yeah.
And so, as you start exploring them and trying to sort of understand those beliefs, where did those beliefs come from? Did they come from your childhood? But maybe, maybe you struggled and people around you were not very supportive, or maybe you had very pushy people around you who nothing you did was good enough, whatever they could be. Or maybe you were bullied in school, or whatever, right? They could be some specific event. Sometimes we're not able to find tie it to a specific event, but
Mhm.
it's still a core belief that this person has about themselves. And then you just treat it like any other. you know we all have our own concerns about ourselves, right? We all have
Yeah.
things that we wish we didn't believe about ourselves, and we
Yes.
explore that the same way.
Exactly. So that's really, important. I think what you bring in, it's these sometimes voices like I'm worthless, I'm not good enough, and they're sometimes very harsh, and we're not consciously able to feel and sit with them. So we put it outside, and also thoughts like, or voices like, I'll kill you, or I'll murder you. Stop. So this and that very commanding, threatening intensity of it can be there. And I think when you bring this up, connection to sometimes to the memory, let's say a memory in a childhood. So I mean, I think we both will perhaps agree that if this thought and voice is there, perhaps something like this experience has happened in person's life at some point of time where they've been told this thing. So let's say a child has been told by somebody, or that you are going to die, will kill you, or whether in a bullying experience, or even somebody, sometimes the parent said it, that you don't deserve anything, you're worthless. So in that moment, that the child may have a very real experience of feeling that hurt, feeling that void, feeling that hurt, worthlessness. But somehow there wasn't proper space to stay with that. There was like, certain kind of flip around that, okay, you cannot feel these emotions, you cannot stay sad longer, and you have to come back to this normal functioning life, go to school, do that. So this experience just deposited and repressed in person's life, and later on in 20s or 30s, when we see a lot of psychosis perhaps coming up, is when these repressed material from their life, which did not get a space, then begins to come out as this strange experience. I mean, how do you feel about that?
Yes, yeah, yeah. And the only thing is, for some, not everybody has sort of explicit events where they were told these things. Sometimes these might be things that they perceived, even though, they may not have been actually told that, they're worthless, or they might have felt that, nothing they do is good enough, or maybe, they, whatever. So it's about more about the person's perception than necessarily.
Mhm.
Sometimes it's very explicit. You can make very clear connections to very
Mhm.
specific traumatic events or very specific things. Sometimes we can't. So
Yeah.
I think that's it's like, the way we make sense of the world, the way we sort of build our schemas. And then, it's just a very intense, again, I think of psychosis as a more extreme version in some ways of anxiety. It could be a more extreme version of PTSD. It's a more extreme version of, depression sometimes, right? It's really just all of these sort of amped up more.
Yeah, more, and they become like intense experience of
Yeah, all of
um,
us have anxieties, right? We all have anxieties. We all say, oh, what if I lose my job tomorrow? What if I'm out on the street? We all have these thoughts.
yes,
But when that becomes so intense that you feel like it's actually happening, or it is definitely going to happen, that
yes.
would be sort of, we're getting closer to that experience of psychosis, right?
Yeah. So it's much more intense. I want to come back to this experience that in some moments when we are not able to directly correlate or find a really proper link to a memory in the past of the person. So uh in my work, like with people, and also in my own experience, my own therapy, which has moved more towards the somatic work, like so after like being many years more like in we're trying to find language, and after 4 or 5 years there's a more in touch of going into a somatic layer. So I was also thinking that when there's no direct link with the memory, and I've also seen my clients that often the memory is just stored in is so much repressed but stored in a somatic body. That by somatic body I mean that uh like our body have sensations all over, and these sensations carry certain emotions, and through those emotions, as we feel, we are able to access certain kind of memories that were not very conscious to us, and certainly from our childhood, when we may at least before 5 years of age, when we can't even remember consciously what really happened. Maybe the earliest memory is 6 7, I don't know. but uh but our body, but our body keeps the score, I mean, as the book says, or as our body keeps some kind of record of everything that has happened to us, like for example, a tree has a history in it, imprinted on it with its marks and everything, and it carries the history of that land in some ways. I mean, that's what one perspective was. Similarly, as humans, as our body also holds everything uh, that we've gone through, perhaps in some ways or the other, not as a language, maybe, but as a somatic. So I'm wondering if there is any kind of space in your work along with CBT that you try to access somatically, that if this person have just a perception disorder, like but they're perceiving voices or something, and we're not able to see any kind of trauma in their life, in the history, in their developmental history, is there ever movement towards somatic work where you're able to access their sensations and through that reconstruct the narrative of their past?
So I don't know if this is what you mean when you say somatic work. So the way I think about it is that I don't I so emotions, when we say I'm feeling such and such, I'm feeling happy, I'm feeling sad, these are just words that we essentially use to describe certain body sensations.
Mm-hmm.
So some people are not able to tell me, they might just say, I'm very anxious, or some people can tell me that. Some people can say, I just feel something. I don't know what, so they're feeling something in their body and they're reacting to what that feeling is. And I think a lot of the work, sort of, if you look at CBT in general and sort of new wave CBTs, a lot of it is sort of based in mindfulness and so on. So there's a lot of, you know, attention to what you're feeling in the body. How do I know that this is anxiety? Like where do I feel it? I feel tightness in my chest. I feel whatever. I feel whatever sweaty, or I feel like my hands are shaking, or my head feels tight, and so
Yeah.
on.
Yes.
And really sort of honing in on those sensations. We're not even looking for memories that people don't remember, right? I mean, that's in some ways it's not important from my perspective. So I'm not trying to even connect those specific. If somebody says, yeah, I was whatever held up at gunpoint, and whatever that guy said, this and that, what sort of plays in my head, then sure, we can talk about it. But often it's about, the big thing for me is, really learning that anxiety is the most common
Mm-hmm.
response that comes, right? That fear response.
Mm-hmm.
And so sort of really saying, okay, is this fear response in this moment, is this because there is some danger around me?
Mm-hmm.
Or is it that I am perceiving danger where there is no danger? And again, from a trauma perspective, that makes sense because, if you have experienced trauma, something bad has happened to you, then you're better safe than sorry. You're going to look out for those things to make sure it does not happen again, right? So that
Yes.
makes sense. But even sometimes when there's no obvious connection to a trauma, it's still that same idea that we do a lot of sort of body scans, sort of noticing what you feel in your body. Because if I tell even the language, sometimes if I tell myself I'm anxious,
Mm-hmm.
it sort of can make me feel like I should be anxious or there's some reason to be afraid of. But if
Mm-hmm.
I say, oh, you know what, my heart is beating, my hands are sweaty, and
Mm-hmm.
I'm just going to watch my hands, see, are they sweaty just in my palms or both palms? Are they sweaty out, on the other side? Are they sweaty like in my armpits? Like, where all am I sweating? Like,
Yeah.
okay, it feels tight in my head. Does it feel tight in my chest?
Mm-hmm.
Like, do I feel like butterflies in my stomach? Like, oh, what is that like? What does that feel like? Does it feel like it's on the inside? Does it feel like it's on the outside? So really approaching those sensations with curiosity
Mm-hmm.
and defuse that the sort of the build-up of, oh yeah, I'm anxious, so now I have to look for things, and so now because I'm looking for things, I see more things that sort of
Mm-hmm.
get that anxiety going. So this
Yeah.
actually can break that cycle, right? Just sort of focusing on the body sensations, just saying, yeah, okay, and again, approach rather than avoid, right? That's the big thing, because the avoidance is what keeps a lot of these things alive. Is like, okay, what is that thought? Oh, okay, I'm having this thought that whatever. So then what do I feel in my body when I have this thought? Okay, that's interesting. When I have this thought, my heart suddenly like starts racing.
Yeah.
Nothing else has changed in the world. So, the world has not become a scary place. But when I thought that, suddenly my heart is racing. So it's just my body is just reacting to these
Yeah.
things. It doesn't mean that it's always in danger. And look around you, collect evidence, right? See, are you in danger? Is somebody coming at you with a big stick? Is somebody going to hurt you? You're actually, no, you're at home, you're in a safe space, you're surrounded by your loved ones.
Mm-hmm.
So, can we notice that, yeah, sometimes, my body, goes off, is sending these messages even when maybe it's objectively safe. And then you keep collecting that data and sort of feeding it back into
Yeah. Yeah.
the sensing.
Exactly. We would call this more, I wonder, like a cognitive distortion. Like, I wonder if that's how you put it, or you would say that so there's an association with certain kind of sensation. And
Yeah, so we try to walk away from words like distortion and so on, only because the way we think about it is any belief that the person has that they're sticking to
Mhm.
is probably something that's been helpful to them at some point. It's probably kept them, safe sometime. It probably has helped them get through something.
Mhm.
So when we say distortion, it sort of gives, sort of says, okay, this is bad, this is good.
I
We're
see.
trying to walk away from this is a good way of thinking, this is a bad way of thinking. We're really thinking about, is this helpful for you now?
Mhm.
Right? Thinking that, for example, if, again, going back to the trauma case, if, if a child was, treated very badly by
Mhm.
their parents,
Mhm.
it was probably very helpful for them. It probably saved their life to have this belief that nobody cares about me and that the world is dangerous.
Mhm.
So it's a very helpful thing. It probably kept you alive at that point.
Mhm.
Now, when you use it in your surroundings with your friends or your spouse or your children or your, people that actually care about you, now it may not be as helpful anymore. So we sort of think about it as, is it helpful or is it not helpful? Rather than, this is distortion or this is
Mhm.
whatever. Is this even true or not true? It's very hard to know, right? So
Yeah.
is it sort of getting you further along in the path that you want to be on, or is it sort of holding you back?
Exactly. So that's a very good point to see that whether it's helpful or not. But I'm also wondering if does the person really have a choice? Because because let's say in a very intimate setting with their parents, the person has internalized those thoughts and beliefs. That object, that sense of
Right.
internalized object is there, and
Right.
that's being having a transferential communication in most places, whether in friends or other groups. Now, one is that I feel a sense that you're helping them to become aware that of the present, like this certain insight which is absent, you're trying to bring in that it's it's not happening anymore. It probably was happening sometime, but does it come to a choice when we say it's a helpful, it's not helpful, or it's so overpowering for the person to not stop it? It's so
It's
unconscious.
Yeah, yeah, it's not easy to make a change because these are habits that have kept people alive for maybe 10 years, 20 years, 50 years, sometimes even longer, right?
Mhm,
So it's
mhm,
not going to be easy to just undo that habitual thinking in that way suddenly,
mhm,
but we sort of chip away at it a little bit at a time, right? I mean, we start with maybe the therapeutic relationship itself, like, how do you trust me? Like, and sometimes people will like push against that, right? They will like challenge you, and that's okay, right? Sure, test me. Like, it's okay. Find out, this is a safe space. There's sort of no uh you can test how much I'm going to be there for you. You can, not that that it doesn't condone like abusive behavior and so on, but within limits, right? You can. So people will do that, and then you sort of say, okay, how can you expand this to one other person? How do you do it? Maybe we have a therapeutic group. Try it with other group members that are all there to support each other. Then you sort of slowly build that new sense of safety
yeah,
in some ways, right?
yeah,
It's
yeah.
not something that's going to change overnight, or just because you suddenly have this insight, you say, okay, great. Insight itself is a very weird word, right? Because insight essentially means that, you're thinking the way I'm thinking, or
Mhm,
you're thinking the way I think is the right way to think. You
mhm,
don't have insight because you're not thinking the way you shouldn't be thinking that way. You're still thinking that. So I say you don't have insight. it's
mhm,
a it's a very loaded term, and especially I think in the world of psychosis,
mhm,
insight is being used often to in a pejorative way, right? What
mhm.
is insight? I don't know what insight
Yeah,
means
I mean,
really.
I by inside, I would say that, it's not just that imposing something from outside, and making it something that is outside becomes inside,
Mhm.
just the in. It's not, I don't see that as an imposing. It's something that the person themselves feels. It's more like a realization, or a person feels sense of clarity in terms of their perception of their own experience sometimes. So it's like the word
The
insight.
making meaning of their experiences.
Yes.
Yeah.
So exactly. So the word insight word itself means that the vision, the sight is inwardly, and the
Yeah,
person is
yeah.
able to.
The reason I was pushing back is because in the psychosis world, insight is used very pejoratively often, where
Okay.
people will say, "Oh, whatever." If somebody has the thought that whatever something that I don't believe in, immediately you say, "Oh, that person has no insight into what's going on." It's like, well, that's their point of view, and maybe they have reason to think that way, and
Mhm, mhm.
it's okay.
Yeah.
We
Yeah.
don't we don't all have to think the same way about everything.
Yeah.
Right. So,
Exactly. I mean, and now exactly, and I think here we probably would want to also distinguish between how, uh, like for example, how we when we meet the client in the therapy room, and how we are outside when we are doing, I mean, for doing the case formulation or conceptualization, because the phrase that you mentioned, that that, oh, this client does not have a insight, and sounds like a, I mean, that can also be expressed more compassionately in a, but also not very authoritatively, that, hey, I know the person doesn't know, and we can learn from what they are saying. But I'm also sensing that maybe this is a language of the phase of conceptualization or case formulation, where you begin to sort of, how do you make an understanding of that client you're working with, right? um,
and often that is also done collaboratively, right? I mean, that's
right.
also something that we do
Mhm,
in the room with the person, saying, okay, like, tell me, how do you make sense of these things? I mean, again, like I said, I don't know everything. I don't, I'm not going to make sense of their world for them, but, I might be there to ask the right questions, and sort of with that genuine curiosity and a genuine like caring, right? And, ask those questions to sort of create this sort of joint sense of what's going on, which which is sort of the conceptualization, right? Conceptualization is really about sort of understanding, why a person is, responding in a certain way to certain external stimuli in some ways, right? If at a very basic level.
Yeah, yeah, exactly. And I really appreciate that how you bring this more like a collaboration, like a dialogue together, how you see your experience of voices, how you find them, how you see them, and how you're able to sort of navigate through them, and we can work this together. Where is it coming from? So I think it brings a sense of being a human again, like a being somebody who are valued and loved and cared for, and creating a safe container where actually they'll feel like sharing more rather than just very dismissive and very sensing that okay, you have psychosis, you're like trash, we want you to be just functional at any cost, like the earlier workplace you had where what sounds like a very coaxing and manipulative way of just engaging in certain way and then helping them to get into medication, right? That's all.
No, I mean, I actually have not worked in such
Yeah.
workplaces.
Okay.
Luckily, I think
Yeah.
I think that was sort of the general
Okay.
tone of training, like the teaching, like in classes and so on. That was sort of the sort of the way people would talk about people
Okay.
with psychosis. I have been extremely lucky in that, I've always been in situations where people have been treated as human beings, again, somebody who is going through a difficult life situation that it could happen to any of us, right? I mean, I'm just lucky that I haven't had those experiences sometimes. Or
Exactly.
maybe I'm not so lucky, because for some people I think these experiences of psychosis can be very can spawn a lot of creativity, can spawn, yes, it comes with distress, but it can also, there are
Mhm.
also good things that some people will say, I don't want to take it away, like I
Mhm.
want those voices, they're my companions, like don't take them away. So
Yeah.
right,
Yeah. Yeah. That is true. If we just talk more about the creativity, because this is something being talked about that many people with psychosis have, for example, creativity side, which is something extraordinary sometimes, but there are other instances where it's so distressing. For example, when we talk about Van Gogh or
Mhm.
people like that, or even people like John Nash, who had schizophrenia and works in economics and mathematics, I think. So
Right.
there's a, of course, without glorifying or romanticizing psychosis, still, is there a side to them which is they're more creative than than usual? Is this something you've noticed? I don't know, in your work with your clients.
I think people are extraordinary in their own ways, right? I mean, people have all kinds of talents, and I could see how if you're not sort of bound. I mean, creativity is sort of thinking outside the box, not being bound by the conventional sort of boundaries, and maybe psychosis sort of loosens some of those boundaries and helps us think outside the box.
Hmm.
I don't know that having psychosis necessarily makes somebody more creative, or that not having psychosis does not mean you're creative. So I think that, I think each individual is different. For some people, I think they do talk about, especially, I think especially like psychosis, but even like mania and so on, those are times when people can feel very, the associations are a little looser, and, you can sort of think outside the box. And I will say, again, some of their best creative work is done at those times.
Hmm.
Uh, there's this Japanese artist called Yayoi Kusama. I don't know if you've,
No, I don't
um,
know about him.
so she has these sort of exhibits that you can walk through. I haven't actually walked, I've watched videos of it, but I think she talks about how, though it's all these light installations and all kinds of interesting light patterns and so on, and she says that that is supposed to sort of capture
Hmm.
her internal experiences as you walk through that space. So she's trying to capture that, and
I
it's
see.
fascinating.
Yeah.
So
And she's someone who's gone through with psychosis and She's
she's experienced, I think she's experienced psychosis at some point
okay,
in
some
her
point in
life.
time. Okay. So
Yeah.
that's wonderful. She's bringing her inner life outside to for us, all of us to witness and make sense or be part of it together. So that's a beautiful way of, the art way it can be expressed through.
And
So
which sort of comes back to what is psychosis, right? It's like,
yeah,
if it's, yeah, just because you think differently, you have experiences, um, some people think in pictures, some people think in words, some people think in sounds. So,
yes,
and, we don't really have access to other people's internal experiences. So, I think there's probably so much more
yeah,
variety than we even understand. Because
yeah,
we're sort of used to whatever is happening in our head and we think that that's what everybody else's experiences are.
yes. And one of the ways also I see that perhaps we have, I don't know if you'll agree, but there's a lot of emphasis on one way of learning, right? Maybe like for example, you say a lot of us are different. Some of them are us are good in just hearing and seeing, and some of them are can are more about musical intelligence. So, but I think perhaps I don't know how, but it's more our even our academic environments is are more about the language, the head, the academics is more about this reason and logics. I wonder if that's something is there you find there also, but and neglecting the heart and emotional, spaces, or even also accessing somebody who wants to like who learns better than with just hearing and sometimes just touch and seeing, and these faculties are not as developed as just the like the one organ of intellectual that is just too much predominantly taken place. And yeah,
Yeah, absolutely, right? I mean, when we think about, the yeah, I mean, the way we perceive things, the way we take in things, the way we think. Some people are verbal learners. Some people are, if you gave me a drawing and asked me to flip it on its head, and I couldn't do it. Some people can do that like without thinking. Like I have two left feet. I have no kinesthetic skill at all. But you
mhm,
give me like words, I can like string together words. I can think in words. Like I'm a very verbal learner,
mhm,
but some people, are much more maybe in tune with their body. Like they watch a complex dance step and they can just like copy it without, thinking. For me, you break up a simple dance step and I still am tripping over my feet. So, we all have these different abilities. And, I think some of these, yeah. And again, it's
yeah,
not about everybody being the same or thinking the same. It's about the distress, right? We only really should be doing anything when somebody is distressed, and yeah, and then also, giving people a sense of hope that this is not just because, you've had this experience that was distressing, doesn't mean
yeah,
that
yeah,
it's going to happen for the rest of your life. It doesn't mean you can't, go to school or work or get married or have children or whatever it is you want to be doing.
exactly. That's true. That's just a sense of freedom to it, and freedom of choice. And I wanted to just spend time a bit talking about maybe one of the other experiences of psychosis when we say what is really psychosis. And one of the things comes out is also we talked about hearing voices. We also looked at a bit these unusual beliefs. I was wanting to look at maybe paranoia a bit and your thoughts on it. Like what is, you know, how do you understand paranoia? Where is it coming from?
Again, in a very similar way, right? Paranoia is something, paranoid thoughts are things that often, bring up an emotion of fear in us.
Hmm.
And so, again, if you go back to the, trauma experiences, it makes sense that somebody who's experienced traumatic events is afraid of the world around them, afraid of people around them, afraid of specific situations.
Hmm.
And and again, sometimes we're not able to make that direct connection to a traumatic event. Some people will say, I've lived a good life, I haven't had anything, but now I'm afraid. But again, it's the way we approach it is very similar, right? It's again, so you feel this sense of fear in your body in response to something.
Yes.
Now, is that, from a CBT perspective, we try and understand, like, is there really, like, what is the reality, right? Reality is a loaded term because
Mhm.
everybody's reality is their own reality. But, what is the likelihood that you actually are in danger?
Mhm.
And, have you been in these situations before where you
Mhm.
felt scared, but nothing bad has happened? So, or can we put ourselves, obviously, we don't want to put anybody in like a situation of real danger so, I'm not going to ask somebody to walk around in a dangerous neighborhood alone at night by themselves. Absolutely not, never, right? But, how do you start with, if you look at a scale of 0 to 10, let's say, how do you start with something that gives you an anxiety of maybe a 1 out of 10? Can you sit with it? Can you just notice what's happening in your body? Can you look around you, collect evidence, see, are you actually in danger?
Mhm.
And if you sit there for half an hour and nothing happens, try it again.
Yeah.
And over time, your body will say, okay, yeah, okay, even though my heart is beating, maybe,
Mhm.
maybe, I can recalibrate that. Maybe your heart won't be beating as fast. Maybe you won't be sweating as much, after you do that a few times. And then you can sort of go into more
Yeah.
more things that seem more threatening. We never, in our therapy, we never want people to actually, we're not trying to get them to do daredevil things. We don't want to put anybody in danger ever, right? So
Mhm.
we, try and think about what are those things, and what if there is danger? How will you get out of that situation? Right? We have to plan for that because there are no guarantees in life,
Mhm.
right? I can't guarantee that something is going to be safe. So, we come from it from that open perspective that, we're going to gather some data. Let's try it out and see.
Yeah.
Let's try something that maybe, your friends and family have done many times and without any bad effects. Can you try that and see, even though it feels anxiety provoking
Mm.
to you?
Yeah.
And can we check it out?
Yeah. I wonder if that also leads to, in any way, a relationship with their own, like these experiences in a way that, hey, actually, you're right that it's not happening to me. I've sat with it for like half an hour every day, and I see that, yeah, nobody's coming after me. There's no persecution. Nothing is happening. But I still feel that way. I can't stop feeling that way, but I see that it's not happening. So then does the relationship they have already have with this becomes like, oh, there's a crazy part inside me. There's some kind of mad part inside me that, just keeps telling me out of nowhere that somebody is going to say, and it's overwhelming me right now. And during the stressful event, that just becomes overwhelming. Otherwise, I can manage it, but it's not happening right now. Is it like, does it become like othering it more
No,
or?
actually, I think what happens is, as you sit with it and you expose yourself to these situations that are, objectively safe, the physiological reaction also starts slowing down. Your body, after a while, your body is not as stressed, it's not on edge. Your body is actually reacting to, it's sort of habituating, right? So you're actually not feeling as, you don't feel those palpitations, you don't feel so sweaty, you don't feel so shaky. And so it's sort of like a feedback loop that your body also starts calming down.
Mhm. Mhm.
Then, you're sort of I think about it like recalibrating your smoke alarm, right? If you're, we want to have this, here in the US, like all our houses are built of wood, things can catch fire very quickly. It's important to have a fire alarm. All our rooms have fire alarms, and it's important that it works. It's important that it screams when there is a fire. But if it's going to scream every time I put my toast in the toaster, then that's a problem. And so, how do you recalibrate it to make sure that the sensitivity is right, but it is catching? So, fear and anxiety are good emotions, right? They're telling us that there's a sense of threat in the environment. So, we don't want to turn it off
Mhm.
because otherwise I'll be jumping out of windows or running into traffic, and, it wouldn't
Yeah.
be good for me. It's good for me to have a sense of fear. So, how do I have fear when a car is coming at me enough to jump out of the way?
Mhm.
But not when I'm just sitting in a safe space and I just have a thought about something,
Yeah, or I'm feeling that car is just coming to hit me even though it's not there.
even though it's not right. Exactly. Right.
So exactly. So I think so. Few of the psychiatrists I've spoken to, and they shared that that of course there's a threat, that detection that's already there. Like I mean, it's so what they would say that it's that's it's malfunction or the person with psychosis, their ability to detect threat is that system that rings when the alarm is there is just it's malfunctioned in their physiology, in their brain, and it's just functioning more than usual, right? It's giving unnecessary alarms. And they say that, so one of them said that the reason they prescribe antipsychotics, what actually, how does antipsychotic works according to one psychiatrist, was that it just takes away, that it diminishes that threat from their landscape. So, and according to them, they say that it's a more like an evolutionary perspective, that because at some point of time, we all of us came from a space when we were always in a predatory state, like scared somebody will come and hurt. But for some people, that did not stop. Like it's still happening. That it hasn't gone off. It hasn't evolved, or that's what. And so that's one of the reasons they always feel threat when there's no threat. And yeah.
I don't know what has not evolved. I think you're, I mean, I also do believe that we're all descended from, our caveman ancestors who were alive to that sense of threat. Because, if that caveman is walking somewhere and there's some rustling in the bushes and he says, "Oh, I'm not going to do anything," he's probably going to get eaten. We're probably not descended from that guy. We're descended from the people who were
Mhm.
careful about the berries that they ate, careful about where they went. So, it is wired in. But I mean, yes, again, medications can help numb some of that. But I think I mean, obviously, like I said, I'm not anti-medication. I'm not saying people shouldn't be on medication. But I think that's where therapy can help a lot also, because it's about actually re-evaluating and recalibrating this sense of threat. And it does work, it feels very unbelievable to somebody at that point when their threat system is screaming and their anxiety is at 10 out of 10, it's like nothing is going to help me. But
Exactly.
over time, you can actually, with all the mindfulness, with all of that, you can recalibrate that
Yeah.
that whole sense of fear.
Yeah. And I think in that process, you also probably feel a lot of feelings with them, that they're terror, because often in paranoia, perhaps there's a lot of terror of just which is being projected out, right? So there's perhaps in that recalibration, there's a lot of emotions that perhaps you would spend time with. And it's also amazing how this can actually happen, that a person slowly can shift in their sense of self and begin to feel stability and begin to feel safety that they have never experienced, like while growing up or ever in their lives. So yeah, that seems very remarkable to that. Yeah.
We sort of use a lot of, like I said, newer a waves CBT techniques, especially for psychosis. We use compassion focused therapy. We use like the feeling safe protocol, talking with voices, and so on. And really, yeah, the idea really is that just because I feel fear does not mean I am in danger, right? So sort of being able to decouple, like in general, like from an evolutionary perspective,
Hmm.
and the use of the emotion is when I'm feeling afraid, it tells me that I'm in danger.
Hmm.
But sometimes, we need to decouple that a little, not completely. Again, we don't want people to have no fear at all. Fear is a good thing,
Hmm.
but not to feel it to such an extent all the time for everything.
Hmm.
There are situations, if a lion is coming behind me with its mouth open, I should be a
Yeah.
10 out of 10. I should pick up my feet and run, right? I can't just sit there and say, "Oh, sweetie, hello, kitty." That's not going to end well.
Yes. Exactly. That's true. That's true. There has to be a real sense of where's the danger, when's the not danger. Is there more the perception around it? I wanted to also think about. I wonder if you ever come across the work of R.D. Lang in terms of working with people with schizophrenia. Like, so he would often say that the person is experiencing this ontological insecurity, which by which he would mean that there's annihilating anxiety and the terror in their existence, in their being. And I wonder if that sort of experience you had with your clients, or in the moment they're just very not in their being, their existence itself feels very terrifying. and just it's so fragmented that it's so hard to just even, feel safe at all. I wonder if that extreme experiences you had in your work and or any associations with these experiences.
Yeah, I'm not familiar with the work that you're talking about, but yes, absolutely. In terms of, sitting with somebody who is feeling completely panicked, terrified, absolutely, yes. And that does happen at times when I think some of these experiences, it could be the
Mhm,
voices, it could be the thoughts, it could be body sensations, it could be anything that can feel very, very scary to
mhm.
the person in the moment. And yeah, I mean that I've certainly, yes, we do see that quite a bit.
Yeah, that's true. That's good. If I have to ask you, how much challenging do you find your work? Of or like, how do you care for yourself when you're working, so many hours in this kind of work? You're always surrounded in this kind of work. You're also teaching work in psychosis. Somehow it seems like you've built your identity around psychosis and at least your work identity. I mean, of course, I'm sure you're doing many more things that I know, but as you've shown, but still there's some component of your life is around it, right? Around psychosis. Yeah.
So I think the way I can do the work that I do is that I'm very lucky to have amazing colleagues. We work very closely together. Our team is very tight. Uh, you know, our psychiatrists, our social workers, our other therapists, students, trainees, across the board, we trust each other completely and we rely on each other a lot.
Mhm,
I don't think, I certainly, I can speak for myself, I wouldn't be able to do the work that I do without that sense of support. I mean, there are many, many times when, I'm texting with, one of my colleagues and, we're jumping on the phone and, doing impromptu like consults, I'm concerned about somebody or something has changed or, somebody's doing well or, whatever. It could be good things, it could be scary things, it could be just, informational things. We're constantly in touch with each other. Uh, our our clinic team, we meet 3 times a week, so
mhm,
we're very meeting heavy. And again, that helps again because we have a lot of touch points with each
mhm,
other because
mhm,
we work in a hybrid way. Sometimes we're in the office, sometimes we work through
mhm,
telehealth, and we're all there different days and so on. So we have, like I said, 3 touch points every week. So that's another big source of
Structure,
support and time and
grounding.
structure for us. And then, of course, there are other things, that you have to do. I think every therapist has to find their own ways of self-care, right? Their own whatever practices. It could be meditation, it could be exercise, it could be whatever the therapy, whatever
Mhm.
you need to do to make sure
Yeah.
that you're supported and that you have
Mhm.
that you have that
Yeah.
you're not sort of letting these things impact your sleep. And to be honest, I mean, have I sometimes had sleepless nights worrying about somebody? Yes. Not
Mhm,
every night, not all the time,
mhm,
not most of the time,
mhm.
very rarely. And when that happens, I know that's something that I need to bring up to, to
Immediately.
make sure that I'm doing extra to take care of whatever. It could be a message that, maybe something's picking up that, this person's struggling more, that, it's sitting with me more. So then I consult with my colleagues, and so on. So
Yeah, yeah, because sometimes the conflict that you experience with your clients perhaps is just deposited in us, like, and they might experience a relief or not, but you carry on that. It's more like an indirect trauma, if we can speak like that.
yeah,
Mm.
yeah. And I do a lot of trauma treatments as well. I work at the PTSD clinic. So I also
Mhm,
bear witness to a lot of trauma narratives. And so again, I have to make sure that I have
mhm,
a sort of a structure in place, a discipline in place to make sure that I
yeah,
my self-care.
yeah, yeah. When you talk about the spiritual practice or any meditation or anything, I was wondering, do you have any such practices that you do consistently? Or yeah, you do.
maybe not as consistently as I would like, but I
But
do have a meditation practice. I do, I try to, as far as much as possible, I try to, you know, like have physical activity, meditation. You know, I also, do some mindless binge watching of comedy shows, sometimes, depending on the day and time, it could be any or all of the above. It might be as simple as, drinking a cold glass of water very mindfully,
mhm,
just even taking the 2 minutes that it takes to drink a glass of water, but in a very focused way.
mhm,
It could be sometimes it's, getting out and just going out in the sunshine,
mhm,
for a quick walk, just, maybe a 5-10 minute walk, even feel the sunshine. Again, the mindfulness practice, it may not be a full,
mhm.
1 hour of meditation. It might just be a quick, like, what does the sunshine feel like? Like, where do I feel warm? Where do I feel cool? That sort of thing. Just sort of, again, very, some of the things that and I learn a lot from the work that I do with my service users, my clients,
Mhm.
because when I'm telling them things, then I'm thinking I should be doing this as well. So
Yeah,
it's a reminder to me to
reminder. Yeah.
practice what I preach.
Yeah, exactly. This actually came across in one of the earlier podcasts with another physician who's like, we talked about how can we do, things before, like how are we really doing things in our own life before we really suggest to our, to our patients and clients. And also it becomes a, way of holding back and saying, okay, yeah, let me just learn to do it myself. And then only I'm in a state to tell other person because we are also continuously evolving and growing. It's like our work is such that it always challenges us to, take us to maybe extreme states within our own self while we're working with the clients. And like, you meant sharing that not able to sleep some nights. It's an experience of acute sense of empathy also, but also discomfort that you're carrying together in yourself, right? So
Luckily, that's a rare occurrence, but when
yeah,
it happens, then it's like, okay, I really need to do something about this.
yeah, yeah. Yeah, and that's very natural to have, I think, in this work. And um, so there are two threads I was following right now. One was that if you can actually spend a bit more time, little bit more time, just on your experience in PTSD center that you work on, like how is that for you? What kind of post-traumatic stress disorders, what kind of past traumas do you see? Is it just in for veterinarian, like people from military, army, or is it an everyday ordinary people in US or just a South Asian community? And what kind of traumas do you see? Do you see experiences there? Yeah.
So yeah, so our clinic is just an outpatient clinic. So I mean, once or twice we might see somebody who's a veteran, but most people are civilians.
Hmm.
The traumas are, sort of unfortunately everyday traumas. When I say unfortunately, the reason for that is that these are so common. So, I mean, we see a mixture of sexual assaults, physical assaults, accidents, murders of family members, I mean, um,
Yeah.
any domestic violence. We see the whole gamut of,
Okay. That,
traumatic experiences.
yeah. That's really eye-opening because it's a very common now. Every seems like I mean, I can speak about India and the work I would do with students in the university. I see that there are many students go through experiences of sexual abuse. Many of them have lost their parent or divorced or a lot of domestic abuse in their family, and they grew up and now it's all shattering them. So I'm also wondering, somehow we do see that, let's say, okay, we talk about, yeah, there's a lot of in India, there's a lot of struggles going on, but we also know that in your context, in a place like in your country, right, in your way, you're also saying there's everyday plenty of suffering, right? There's plenty of PTSD you're experiencing, and there's something must be going on in the society that is very invisible, and something must be wrong that is if you
I think in some ways I mean, I don't mean to sound like cynical, but I think it's part of the human condition, right? I mean, as human beings, there are lots of amazing things we do, lots of good things we do, but there are also lots of bad things we do to each other.
Hmm.
And I think that's true across societies. I don't think there's any amazing society where, everybody's happy and everything is perfect. If it seems that way, I don't know, maybe this is cynical. My guess would be that people are not
Okay.
talking about these things,
Yeah.
right? I mean, I grew up in India and, now growing up, I did not, was not aware of many of the things that were happening around me. I only knew about my own experiences. But now, when I talk to people that I grew up with, my friends and so on, they tell me about horrific things that they've experienced that I had no idea about because we didn't talk about these things. These were not things that people felt comfortable sharing that they're sharing now,
Yeah.
now from, many decades later, after being able to process what happened and so on.
Hmm.
And I think it was very, very common even then. It's just like,
Yes.
just didn't talk about it, right?
Yeah.
So I think it happens everywhere. Yeah.
Yeah. So yeah, exactly. And just, I mean, it's okay to have a critique in terms of like socially, culturally, the kind of the way we live with. Like, I just had one conversation with the last part, speaker in the podcast. So I asked her, so she was talking about the society, how it's been going about, and she's an ancestral healer. So she's mentioned. So when I asked her, like, when you go in your ancestral spaces and what as we're critiquing present times, which place do you feel was the most, you would want to go and feel like a home, like, so then she mentions that before industrial revolution, when, that time perhaps is, we're less isolated, we're less lonely, we're less disconnected, there's more connection perhaps, and I'm sure there are many problems during that time also, without idealizing and romanticizing it, but still, I mean, we can say that in our present time that, of course, loneliness is one of those things we can say is more like an epidemic, right? It's just there, right? It's a fact, I guess. I mean,
Right. Right.
yeah, yeah. So
Yeah, absolutely. I don't think there's any one period of time that is better or worse than the other. Everything, like you said, has, there's some things that are good, some things that are bad. If you ask me, I wouldn't want to live in pre-industrial revolution times, when we didn't have flush toilets and electricity. I
yeah,
like my creature comforts.
yeah,
So, right? I mean, yeah. But
yeah,
in terms of violence and in terms of you know, abuse and so on, I would suspect that they were happening all the time. Maybe the victims were different groups of people. Maybe it was one group of people versus another group of people, and so on. And so, I think I don't think it's anything new or different.
yeah. That's for you. It seems like it's if it's in a constant space of having these kind of experiences, and um yeah, so this just probably brings me to the last thread of our perhaps conversation, where we could just explore the other experiences of psychosis that's just left. And I mean, when we talk about psychosis, of course, there are certain things that we bring it, like, for example, like just catatonia, or like just you know uh no motivation, there's emotional flatness, there's no lack of desire for any pleasure or learning. Yeah, maybe some people talk about it, withdrawal or neglect. Yeah, how do you see all these experiences? You know?
So yeah, so these are sort of things that fall into this big bucket of sort of so-called negative symptoms, right? I mean, again, I put in air quotes because it's not like positive
You,
symptoms are good things and negative symptoms are bad things. It's just positive symptoms are sort of dialed up versions of experiences that we have, and maybe negative symptoms are dialed down versions of
contracted.
experiences that we have, right? So I think one way of thinking about it, which appeals to me, is to think about these negative symptoms as a response, as a protective response to the so-called positive symptoms, right? I mean, if I was having these beliefs or voices that are telling me that I'm unsafe,
Mhm.
why would I want to get out into the world? Why would I want to go talk to anybody? I'm safe here. I'm not going to make an effort.
Mhm.
Maybe if I go, maybe I told my friends that, I was hearing these voices or I had these thoughts. Maybe they laughed at me.
Mhm.
That doesn't feel very safe. Why would, it's not pleasurable for me to hang out with friends anymore. It's not pleasurable for me to go play sports with them anymore because, it just doesn't feel the same, right? So we're thinking, one way of thinking about these so-called negative symptoms is really as a response to these experiences that people have in a way that actually again makes sense from that perspective that if I was having these experiences, if I was terrified that people were going to hurt me, that voice is telling me that I'm going to be killed if I'm going to go out, why would I go out, why would I talk to anybody, right?
Exactly. Yeah.
And again, and so, yeah, go ahead.
No, I was just saying exactly. And the person may not feel like learning about new things. They may not feel like living also, right? They may just
Right,
they
right,
want
right. I mean,
to
this
die.
voice is so loud, it's so scary, it's so all encompassing that why would I want to like go on living, like why like what is the point? Like, if I don't believe that there is any hope of that changing, that's why it's really important, right? I mean, I think like suicide rates are very high, especially in the first 2 years after a diagnosis of psychosis. So it's really, really important that early intervention, getting people into treatment, giving people, young people especially, hope
Mhm.
that this can and will change, and that we have things to
Mhm.
help. And it doesn't mean just because you're struggling a lot now doesn't
Yeah,
mean you're going to be struggling for the rest of your life. It doesn't mean your life is over. It doesn't mean any of that at all, irrespective of what is you hear from the movies, what you hear in the news, what your family and people around you are telling you. It doesn't matter. This is yeah.
exactly. That's very important. I think instilling hope in some way, even during those circumstances when it really feels like it's not going to work out. And I think having a relationship in during those times that can bring that kind of experience of hope, either a professional, either somebody in the family, it's something can be remarkable gift because often with these experience comes a lot of isolation and a lot of struggle of just being on your own and a lot of mistrust of others. So it becomes very difficult to have a connection and able to reach there. So somebody having just feeling them, making a person feel seen and understood can be really, really a gift, I think, and very fulfilling. And also,
Somebody who believes in them 100%, right? No matter what,
yeah,
you're still my child, or you're still my friend, or you're still, I still care about you.
exactly, exactly, and that's true. So I think that that can be one of the powerful ways of bringing trust and healing, and in a way that on a journey to sort of what we call recovery or what we call healing and living a good life, living a life with the potential. So a person with psychosis is not just gonna just a function life somehow, but it's somebody who can do much more in life and actually can become more movement towards potential and do a lot more things than is expected, right? Or how being seen, and sometimes in the system. Sometimes, of course, there are people around in the family that's not there supported. Sometimes the medical system, I don't know if the mental health system also scars them sometimes. I mean, I
Oh,
don't
totally.
know. I'm glad.
Absolutely, right? I
Yeah.
mean, I think unfortunately, that's true, right? I think, when we talk about trauma and psychosis, people, with psychosis are more likely to have had traumas, and people who've had traumas are more likely to have psychosis. And when we talk about the traumas, some of these could be past traumas, but the experience of psychosis itself can be very traumatizing, right? If I think something is out to kill me, or that I'm in danger, that's a very traumatic
Mhm.
experience in itself. And then unfortunately, the way the mental health system treats people with, forced hospitalizations, forced medication. Sometimes people are put in restraints, injections without, their, you know, agreeing and so on. All of that can be very, very traumatizing. And sometimes, a lot of the people, that we see, especially if they, if if we don't catch them early and they've been through a few hospitalizations, have some really scary stories from experiences from their hospitalizations, often, unfortunately.
Yeah, that's very shocking to hear, Priya. Also, I was wondering, do you know why it's like this? Why there's the forced treatment? Why there's such a scare and shock around it when this
Well,
can.
so there's two parts of it, right? One is that, sometimes when somebody is not able to make the right decisions for themselves and they're doing things that could put them in danger or can really cause serious damage, then as a society it is our job to step in and help them.
Mhm,
But then that can also go too far,
mhm.
right? It's a very fine balance, and sometimes I think there's a lot of stigma, there's a lot of misunderstanding of psychosis, and so I think people tend to overreact rather than, treat each situation
Yeah,
appropriately.
there's almost a
And
panic, right? A panic
there,
around.
there is a panic. There is a total panic, right? There is a total panic, and and again, the media, movies, all of these things sort of fan those flames of, oh, this person is, when they use terms like this person is psycho or this person is
Mhm.
this or that, mad or whatever, right? I mean, there's a sense of, oh, they're out of control. They're,
It can be
just like
violent.
one of my ex-colleagues who has lived experience of some of these experiences said it very nicely. They said something like, just because you act in unusual ways does not make you dangerous, right? Like, if I don't know, wearing a heavy coat in the middle of summer, that might be acting unconventionally. That doesn't make me dangerous,
Mhm,
right? And we know that people who experience psychosis are much more likely to be victims of violence than perpetrators of violence.
mhm.
And so, really, they're much more vulnerable to trauma and being like victimized and so on.
Yeah,
That as a society, we should be watching out for our,
that's
our the
scary.
rest of our our kind, right?
Yeah, exactly. But there's a harsh panic treatment. Oh, something psychosis just triggers and oh, is it suicide? They'll be violent, they'll be suicide. Let's manage them. Let's keep them in our check. And then without consent, scarring them or harming them. So that's when I bring this reference of Artie Lang, I think you would be curious and would be might be interested in reading more about his work. He he was also like very, skeptical about how sometimes medical system sort of is very invasive and sometimes scars people with psychosis and schizophrenia more than they do good sometimes. So he tried to do a very like a controversial kind of setup, like he or an experiment where he started his own community. He said they just started living together, and with people with schizophrenia can come and live instead of going to an inpatient hospital or going into a very invasive place where they would be taken out of their consent. If they're going through any episode or anything, they can just come and live in this community and go through their
These are like the
experiences.
soteria houses like that.
Exactly. Like so, yeah,
Oh yeah.
yeah,
Oh yeah.
exactly.
Okay.
Like the Terraria home. So,
Uh-huh.
or these kind of respite centers where you can just go through them, and so you have about these Terraria homes, and I wonder, uh,
I know about the Soteria homes. Unfortunately, we don't have anything. In fact, I think the first one was started fairly close to us in Berkeley somewhere.
okay,
But we don't have anywhere near us.
mhm,
We've been, some of the people who come to our clinic have expressed an interest in
mhm,
such facilities, but it's been hard to find any that
mhm,
are nearby because I think in the US, I think people are worried about like liability and being sued and so on, and then it
Okay.
becomes so you have to medical care is very expensive, so how do you pay for it and so on. I think that becomes
Hmm.
a big
Hmm.
problem. So they are not as common as one would like.
Yeah,
I
we
mean,
perhaps go.
we should, anybody who wants to access a tutoria house should be able to go to a place like that, but we just don't have
Mhm.
enough such resources available,
Yeah,
unfortunately.
yeah. Do you think that your department or in the university in Stanford, do I'm sure there's a lot of focus on evidence-based, which is good, a lot of focus on this medical, but is there a possibilities of such kind of fundings, of such kind of possibilities, or do you feel the stretch may not go in that direction because it's too, like you said, maybe liabilities there or may
I
not.
don't know that, I mean, I haven't, I don't want to speak for the management of our department and so on, but I doubt that there will be, money from the department and so on for this. Because I mean, like so the way things work in the US is everything is, insurance based, right? So we bill insurance. And so we see people who, usually most people, not most, yeah, most people that come have private insurance either through themselves or through their
Mhm.
parents if they're younger, through their work. And then we see some people who are on a federal Medicare
Mhm.
insurance.
Mhm.
Um, but so, a lot of the services we provide are also dictated by what those insurance coverages will pay for. So in
Mhm.
fact, very recently, in our clinic, we have a subsection for people within the first 5 years of their first episode of psychosis, which also provides, in addition to psychotherapy and medication management and social work, we
Mhm.
have a case manager, we have a peer support specialist, we have a family support specialist, we have a supported education and employment specialist. We
Mhm.
provide more wraparound care.
Yes.
And that the first year of providing that support was essentially grant funded because
Okay.
that was something that uh, we could not bill to insurance, but now they're trying to figure out how we can start billing insurance for these sort of wraparound services. But a lot of it is dictated by the insurance companies often also, unfortunately.
Yeah, that's very unfortunate because seems like it's just dictated by the insurance companies and their motive may not always be about the care and perhaps more about profit. I don't know if I can say that
I
too.
don't know. I mean, technically, some of them are supposed to be non-profits and so on, but I think, what they think of, how they define good care may be different from, you know, how we might define good care. So it's a complicated, the US healthcare system is very, very complex. I couldn't even pretend to understand, big chunks of it. So yeah.
Okay. All right, that makes sense. But it also just gives a sense that, you know, that there is less funding to certain kind of ways of working, like Soteria House. Or even I was wondering about, is there a spaces like psychodynamic spaces within the team or within the work or more analytical work, but it's predominantly
So our
CBT.
clinic is completely CBT for psychosis based and sort of CBT like approaches. There are people who do psychodynamic work or psychoanalytical work, out there, and I think much more on the East Coast than on the West Coast in general.
Okay,
So I think there's some geographic differences as well.
okay. Okay, that's just makes sense. That's the space it has to be created for that. I think we covered a lot of ground today and we spoke about a lot of things and I really enjoyed, having a conversation with you and learning so much from your work that you do. It's really appreciated. And
No,
I
thank you so much for having me.
yeah, no, you're welcome. And I was just wondering, is there anything else that you feel we've left and you wanted to, bring in or anything that was on your mind and we didn't talk about it?
the only thing I can think of is, something that I've probably said before is that psychosis is not weird. It's not something bizarre. It's just an extension of experiences that we all have at times, maybe more extreme version. And just because somebody experiences psychosis does not mean at all that it defines who they are or what they can do in their life. I think, everybody has the capacity to live up to their full potential, doing the things that are most meaningful to them.
Mhm.
And so, and I've seen many, many, many examples of these, and I truly believe that. So,
Mhm. Mhm. Yeah, that's really nice. I think your vision and your experience and how you look at psychosis very much like I feel has a similar values of what Satoria Home has, that they're also like living together, not judging, not sort of saying, oh, you are supposed to be like, you know, away, distant, or in a very detached manner. So it's nice to hear, you're carrying that sense of experiences even in present context where you are and able to practice like that freely and perhaps that's brings a lot of human and care to people there.
yeah, I know Soteria houses have, their very strong philosophy and so on. I don't know if we're exactly on, doing exactly that, but I think that basic fundamental, notion of humanity, shared humanity, I think is certainly something we aspire to. Maybe we're not living up to it every moment, but that's certainly something that we hope to keep in the back of our mind all the time.
That's great. Yeah, exactly. So I'm really, really appreciate you sharing all of this and bringing a humanness to this experience of psychosis where we often see the experience has lost the dignity, the people have lost the dignity and the respect in our society. So thank you for this well-ranged conversation today.
Thank you so much for having me. It was lovely talking to you.
Yeah, thank you so much.
Okay, okay,
Yeah,
thank you.
let's stop here. Yeah.